Good morning, everyone, and thanks for joining us at Sunset Elementary School. Principal Chandler, thank you for your leadership at this school and the good work you're doing in these very trying circumstances. Today I'm joined by Arizona Superintendent of Public Instruction, Kathy Hoffman, Superintendent of the Cartwright School District, Leanne Aguilar-Lawler, Cartwright Governing Board Member, Marissa Hernandez, and Dr. Kara Christ, Director of the Arizona Department of Health Services. COVID-19 is unlike anything we've faced as a state or a nation. Combating this disease has placed strains on all of us, from businesses to first responders, health professionals, and of course our kids and our families. This will test us as a state, but it will not break us. Throughout our state, women and men have stepped up to support those in need and our most vulnerable, and we couldn't get through this without them. Today at Sunset Elementary School, we're seeing an example of the good that is happening in schools all around our state. Staff and volunteers continuing to ensure the needs of students and families are met. Just yesterday, the Cartwright School District provided meals to over 2,700 kids and families. Many more are being fed in districts around Arizona. With schools being closed, my office has worked closely with Superintendent Hoffman to ensure that no child in Arizona goes hungry as a result of these closures. And we want every parent out there to know schools are still providing meals for any kid under the age of 18. These resources are available, so please visit your local school district website to find out when and where you can stop by for breakfast and lunch. This morning I also want to say thank you to all the staff and volunteers at Arizona schools who continue to serve our students even during these closures and difficult times. I also want to thank the superintendent of the Cartwright School District, Leanne Aguilar-Lawler, for all she is doing for the kids in this district and the leadership she's demonstrating as a superintendent. Not only is her district offering meal pickup at schools, her team has mobilized school buses to bring meals to kids. And I want to say a special thank you to Superintendent of Public Instruction, Kathy Hoffman. Unprecedented situations like the one we're in call for leadership and partnership, and she has continually risen to the challenge to put kids first and to be a leader for our schools, our children, and our parents, and I'm grateful. Arizona is united in our determination to address COVID-19 and to keep our kids and families safe. We will continue to make this our top priority. We'll continue to work in partnership with our state's leaders and partners around the state. We'll also continue to follow the facts and science and listen to the direction of subject matter experts. And we'll continue to get through this. We are going to get through this, and we'll get through it together. Thank you, and now I'd like to turn it over to Superintendent Kathy Hoffman. Superintendent?
Good morning. Thank you, Governor Ducey, and thank you for your calm and steady leadership during these challenging times. Thank you to Principal Dial, Superintendent Dr. Aguilar-Lawler, and the school board members for welcoming us to your school and district to serve your families and students here today. And thank you all for being here. It's been a difficult week as we all grapple with the rapidly evolving COVID-19 response. With that said, I've never been prouder to be an Arizona educator. Across the state, we've seen educators and schools step up to ensure that the needs of students are met during these closures. One of the most important ways our schools are supporting communities is through school meals. We want to ensure that every child in Arizona who needs meals during mandatory school closures has access to nutritional assistance. The Arizona Department of Education's Health and Nutrition Services team is working closely with school nutrition directors across the state to ensure that all eligible schools are offering meals. Even if a school has not previously offered breakfast or lunch, there is now more flexibility from USDA, and we encourage all schools to consider applying. Our team will help you figure out what options are available. With these services available, no child should go hungry during the school closures, and we want to ensure that every neighborhood in Arizona is served. To see a list of all school districts and charter schools that are already serving school meals through pickup, drive up, as we see here, drive up, delivery, please check our website, azed.gov, and it's listed under Guidance for Schools COVID-19. This list is updated daily, and as of last night, there were 198 districts, charters, and nonprofits offering school meals. In all 15 counties, we have seen schools jump into action, and I'm grateful for all of the school communities that mobilized quickly to provide meals. Additionally, the Department of Education is committed to providing guidance to schools. We are in constant communication with school superintendents, charter leaders, lawmakers to ensure that they have the most up-to-date information so that they can make the most informed decisions from the state to the local level. Over the past week, we have developed recommendations and a comprehensive webinar to respond to Arizona's most urgent questions, specifically to address issues regarding continuity of pay for educators and school staff, special education services, and statewide testing. These resources can be found on our website, azed.gov, which is updated daily as our agency receives information from both state and federal leaders. And although our students are not in their usual classrooms, we know that families and educators are finding creative ways to continue providing learning opportunities at home. To support distance learning, this morning we released a hub of resources for teachers and families to utilize. This includes online instructional materials for core subjects, as well as social-emotional supports to help families have conversations with children regarding COVID-19 in these unprecedented times. This hub is also on our website, azed.gov. During these difficult times, I call on Arizona's education community to set an example of kindness, compassion, patience, and goodwill as we navigate this situation together. Through our actions and words, we can offer comfort, guidance, and reassurance to all of Arizona's students and children. Thank you for continuing to show leadership during this difficult time. Another special thank you to the Sunset Elementary School, the Cartwright School District, for your critical work to serve students in our Metro Phoenix community. And now I'd like to turn it over to the Superintendent of the Cartwright School District, Dr. Leanne Aguilar-Lawler. Thank you again.
Good morning. I'd want to welcome everyone to Sunset Elementary School, one of the only 3 A-rated schools in Maryvale and all in our school district. Welcome Governor Ducey, Superintendent Hoffman, Board President Hernandez, Vice President Garcia, Principal Jeremy Chandler, and Dr. Christ. At the Cartwright School District, we have always touted the importance of staff and student safety. These are unprecedented times. The focus at the Cartwright School District during this time has been to ensure that our students continue to receive healthy meals and to ensure our parents and staff receive accurate and prompt communication from our amazing team, Val, Veronica, and Alma. I also want to let our students and families know that we care very much about you and we miss you terribly. The distribution of meals has been made possible with the support of all of our caring and committed staff. Thank you to our food services leaders, Diane Gruman, Lorraine Stoll, our food services departments, our custodial staff, transportation director, Sarah Hernandez, bus drivers, administrators, principals, assistant principals, crossing guards, members of my executive team, Emma, Becky, Tom, and other essential staff that have been so supportive. I also want to emphasize that all these efforts have been made possible to the support of our governing board and those present today, our governing board president and our vice president, Denise Garcia, including my partners that work daily with me closely every minute of every day, Christine and Linda. I also want to acknowledge Dr. Ceci Sanchez, our Assistant Superintendent of District Operations, and Victoria Farrar, our Chief Financial Officer. They have both been amazing. Feeding our students is not an easy job. It's been difficult because of the unknown and constant minute-by-minute changes. However, it's the right things to do, and we are happy to do it. In fact, last night our team communicated that we're writing a grant to be able to feed all of our students during the weekends. So we're really hoping that we get that grant. Now, I want to address our staff that we've asked to work from home. We miss you too. But this is us doing our part to flatten the curve. At Cartwright, I have seen that this crisis has given us all, regardless of our position, an opportunity to work together, to think out of the box, and be kind in our decision making because we are all being affected. I promise we will continue working to do the best for our students, our families, our teachers, all our staff during these unprecedented times as one team, una familia. And speaking of family, I want to thank my own family who've been a huge support throughout, and also my huge Tucson family that I all want to ensure that they stay safe. Thank you, Governor Ducey, Dr. Chris, Superintendent Hoffman, for coming out to our school district today to help feed our students and address the importance that our students continue to receive healthy meals during the school closure. We will continue to review additional guidance from both the governor's office and ADE. I know you and your teams are also working very hard. Now I would like to proudly introduce our governing board president, who has been incredible throughout the crisis. She is calm, smart, and a courageous leader. It is my pleasure to bring up Cartwright Governing Board President, Ms. Marisa Hernandez. Thank you.
Good morning, everyone. I'd like to thank everyone for being here today and for putting a focus on Cartwright. Thank you, Governor Ducey, Superintendent Hoffman, and Dr. Christ for being here at Cartwright this morning to help distribute meals. We definitely miss everyone. It is hard to do the social distancing, but it is very necessary and critical to the health and well-being of our community and to our state. I'd like to say thank you for everyone's patience and understanding and the collaboration that has been occurring since all the COVID-19 information started rolling out, and to our superintendent and staff for being so quick to respond with the school closures and really putting our students and their families first. And to our food services team for providing all of the meals and making sure that it's at a one stop and that we have enough. Thank you so much, Dr. Sanchez, for being a major part of that, and all of our food services, our custodial workers, our IT department is out here, communications, we've got all of our assistant superintendents. It takes a lot of people to really come up with great ideas, and they weren't created by one sole person, they were created by working together. And at Cartwright, when we say one team, una familia, we really mean that. And that is why we made the decision to close our schools. And our number one focus right now is providing meals to our students. Any children in the community up to the age of 18, you can drive through. We'll make sure that you get your breakfast and your lunch. And we are working on trying to ensure that we can feed children over the weekends as well. We are in unprecedented times, and it is time to step up as leaders and make those brave decisions. And at Cartwright, that's what it's all about, is our community. We love our Maryville community. We love our students. We miss you dearly. For any of our students that are watching, we are working on trying to get education figured out. But at this point, we just want to try to help relieve some of the stress from our families and the students by providing meals. And we look forward to collaborative working in the future. We appreciate when our parents provide us feedback. Please use our social media platforms, parents, to provide feedback for us. And there is a special number that you can call listed on our website, CSD 83. If you have any questions or any restrictions for those meals or why you can't come, you can call that number and see if we can accommodate you. So I want to say thank you to everyone out here today. It does take a team, and I am glad to be part of this familia. I know that when I am away, my team is doing everything that they need to do here at Cartwright to ensure that our families are well taken care of. And that keeps me grateful and humbled on a daily basis. So thank you.
Good morning. Thank you. I'm Dr. Kara Christ from the Department of Health Services. And before we begin this morning, I want to thank my team of public health professionals who are working nonstop on Arizona's COVID-19 response. And I want to thank Governor Ducey for his leadership and making the resources within state government available as we work together with a shared priority to protect the health of our Arizona communities. Thank you, Superintendent Hoffman, and all of the members of Cartwright School District community for your tireless efforts to prioritize the health and wellness of our kids during this response. School plays such a critical role in the lives of our children, providing education, safe places to play, access to social services, including food. For some children, meals provided at school are their main source of nutrition. From our state leaders to the public health officials on the front lines to our dedicated teachers and education personnel, as the governor put it, we truly are in this together. With that, here is the latest on the spread of COVID-19 in Arizona. To date, we have 44 cases. There are 22 cases in Maricopa County, 10 in Pinal County, 7 in Pima, 1 in Graham, 3 in Navajo, and 1 in Coconino. As you all know, Arizona has community spread of COVID-19. We're expecting additional cases, and we know that there will be more confirmed cases as access to testing expands. Because of this, Arizona should continue to exercise precautions during this heightened level of risk. Together, we must work together towards the goal of mitigating the spread of the disease, to lessen the impact on the people at highest risk for complication, which are older adults, people with serious medical conditions like heart disease, diabetes, and lung disease. Here are some recommendations of steps you can take to mitigate community spread. Stay home, especially if you or a loved one are elderly or have an underlying medical condition that puts your health at risk. If you have someone in your household that has COVID-19, everyone in the household should stay home. Please call your medical provider to determine when you can stop isolating. Cancel or postpone events with more than 10 participants. Avoid social visits, shopping trips, and discretionary travel. Choose curbside pickup or drive-through for meals. Avoid sick people, and do not visit nursing homes, retirement homes, or long-term care facilities unless you are there to provide critical assistance. Please implement the prevention measures aimed at reducing the spread of respiratory viruses by washing your hands, using an alcohol-based hand sanitizer, avoid touching your face with unwashed hands, avoid close contact with people who are sick, stay home when you are sick, and cover your cough or sneeze with a tissue. If you need to see a provider, consider using a telemedicine option. We are getting a lot of questions about testing for COVID-19, and I want to provide you with the latest information. There are now several commercial laboratories that can test for COVID-19. However, as you've heard, there is a national shortage of test collection supplies and lab reagents. There are not enough tests for everyone who wants to be tested at this time. But it's important to know, because there's no specific treatment for the disease, the results of a COVID-19 test will not change your clinical treatment while you are sick. Doctors will still care for you the same way. People with mild symptoms should stay home when they are sick and for 72 hours after their symptoms go away. People should seek emergency care if they have extreme difficulty breathing, constant pain or pressure in their chest, severe constant dizziness, or other serious concerning symptoms. We know that many healthcare and laboratory partners are in the beginning stages of implementing screening locations once the supplies become available. We are working with our sites and our federal HHS partners to continue standing up additional screening locations throughout the state. In order to support this activity, we have issued a standing order that will allow symptomatic Arizonans to receive screening at these sites. The Arizona State Public Health Laboratory will continue to prioritize and test samples from those with known risk factors that are sent from our county health partners. As of today, the Public Health Lab has tested 350 people. We've ruled out 175, and there are 130 samples pending. If you are sick, because we know that we expect to see more cases, we recommend that people with mild symptoms of the disease stay home, get plenty of rest, drink lots of fluids, and call their healthcare provider if they have questions regarding which medications to take to help with their symptoms. If you are ill and need to see a doctor, please call ahead before going in so they can give you instructions on how to keep other patients safe. And this is important. Unless it is emergency, do not go to the emergency room. Hospitals and healthcare workers need to focus on the most vulnerable patients, the elderly and those with medical complications. Consider using options such as your primary care provider, a nearby urgent care, or consider using telemedicine where you can talk to a provider from the comfort of your own home. Everyone in our community has an important role in protecting our public health. Even small steps like covering your cough or staying home when you are sick could be life-saving to others. As always, public health is engaged in this in 24/7. We are thinking ahead and anticipating our next steps. Current factual information can be found at cdc.gov, azhealth.gov, or from your local health department. And we will continue to provide the public with the most up-to-date information and advice on how to keep you and your loved ones safe. Thank you. We're happy to answer any questions.
Price, the ladies from the district just said one family, una familia, with more than 1 million Spanish speakers in Arizona. Why isn't there an official website in Spanish at this moment?
So we are currently working very diligently to get our entire website translated into Spanish. So that should be coming within the next day or two.
And for people that don't speak English, what should they do?
You can call. We do have bilingual people that can talk through what to do if you have symptoms or where to go potentially if you need to be seen. So they can call the Arizona Department of Health Services, or you can contact your local public health department.
Justin? Governor, I do want to ask you again about Senator Sinema criticizing you this morning, saying that you're not following the White House or CDC guidelines when it comes to gathering.
I want to make certain that everyone knows the state's going to speak with one voice. We have been following the CDC guidelines in alignment with NIH. We have been hand in glove. Every morning we meet with Dr. Christ. We review what the guidance is. This guidance has changed over time. It will continue to change. After this meeting, we're going to be on a video conference call with the Vice President, CDC, NIH, and the other 50 governors, and we'll make the appropriate announcements as circumstances change.
Governor, though, but President Trump did suggest that restaurants, bars, and gyms be closed where there is community spread. So why aren't you doing this?
We have been clear and in alignment on the communication. Like I said, these things can change. We'll make the appropriate announcements at the appropriate time, and we've been in alignment with CDC and NIH. That's been our guidance every morning, and it will continue to be. I'm going to be guided by the facts and the situation on the ground in the state of Arizona. That's what we're going to make the decisions is regarding our state and our statewide. Our guidance is statewide.
Governor, there was an event, I believe, in Kima County, a number of people who were older, where there was exposure to the virus. It's our understanding that one of the people there later had pneumonia. She was 79, and unfortunately on Friday she died. Are you familiar with that case? And was that related to coronavirus?
I'm familiar with the reporting that's been done on the situation. I'm going to let the subject matter expert refer to the cause of death.
So in Arizona, our local public health departments are our boots on the ground and the experts on the disease and the contact investigation. They are currently investigating cases in Pima County and would be the best source of information for that.
So as far as you're aware, there haven't been any deaths in Arizona related to that?
When we looked yesterday, there had not been any deaths reported due to coronavirus.
Dennis, then we'll close out.
Yeah, no, up to now we've been really focused on test kits and preparedness and stuff like that. But we're starting to see the economic pain and fallout from the COVID-19 epidemic right now. Employment claims spike. Democrats in the state legislature say that they want to add some items to the budget that increases money and spending for people in need, for families in need, for people that are evicted, so maybe unemployment insurance is expanded. What are you calling for in this budget as it moves through the process right now?
So I want to say our first thought through this crisis to date has been around public health, and that's been what we've been focused on, what my team's been focused on, what Dr. Kara Christ has been focused on. Many of the decisions that we've made have been to protect public health, but also to do our best to navigate through this as a state in the safest and most responsible way. And my heart goes out to not only the people that are home and sick, and that are homeschooling with school out, but of course our small businesses and their employees. We're going to be working with Democrats and Republicans on a menu of what we can do from the state level. We're also working with the federal government on that package and what can be done. And the budget that was released on January 21st is going to change dramatically because we're in dramatically different times. Our social safety net is going to be stretched, and we're going to be the ones stretching it as far as we can to protect the most vulnerable and to help real people in this tough economic time.
One of your Republican colleagues referred to some of those requests, like expanding unemployment benefits and other temporary cash assistance, referred to it as pork spending. Is that pork spending?
We are gonna make decisions that help real people in difficult situations.
This might be more directed to Dr. Quist, but I see some states reporting ages. I know there's a lot of uncertainty as to who is spreading and who's actually getting it. Will Arizona soon be actually confirming the cases in their ages?
So we collect information and provide the public the information that they need in order to keep themselves safe. We collect a lot of information on a lot of various diseases, and we want to protect the patient confidentiality because I'm sure if we had, I would not want my personal information put on the website if I had a disease that was reportable. If we feel that there is a danger to the public, we will release the information that they need to know.
One more quick question, maybe for the governor or the superintendent. When will there be a discussion as to when school closures might be extending? I know that should be
Our original guidance in coordination with the superintendent was through the 28th. The president gave some guidance at the federal level, which of course we'll comply with, and we're going to continue to work and communicate so that we make the right decision for public health, that we over communicate, and we're going to be visiting with the superintendent to make certain that our parents have certainty. The goal, of course, would be able to do whatever we can going forward, but we want to do it in a responsible way. But we're going to make that announcement at the appropriate time. And Superintendent, I don't know if you want to add to that.
I would just add that I appreciate the close communication with the governor's office, and that's a strong consideration in terms of how much longer schools need to be closed for.
We have time for one more with JJ. Yes, Dr. Chris, I know you have to maintain confidentiality of the individuals, but can you talk at all about the severity of the cases? Are they contributing to vulnerable population? Are people being hospitalized?
So we are currently investigating the new cases that were added. We don't get the at-risk information or the outcome of the commercial labs right away. Of the cases that I am aware of, we have had elderly involved in this, and we have also had hospitalized patients.
Can you put any numbers on the number of hospitalizations you're aware of?
I am aware of 3.
Thank you, everyone. You know how to reach us for more questions. Thank you.